Hi, this is Jacqueline and I'm doing my assessment on Jen. Hi, Jen.
Hi.
And I'm going to be testing her eyes, her ears, her mouth, and throat. So the first thing I'd like to do is have a look at her eyes, which look symmetrical, and her eyebrows also look symmetrical. And we're going to sort of test your acuity. So I have a Snellen chart back there. So I'm going to ask you to cover your right eye first and then your left eye. And don't press on it because it'll make your eye sort of like irritated and not a good exam. So first hold up in front of your right eye and read the line that you can see the clearest.
E, D, F, C, Z, P.
Good. Can you read the line beneath it at all?
F, E, L, G, P, Z, D.
Good. Now you want to try it on the other side? We'll try your...
E, D, F, C, Z, P, F, E, L, O, P, Z, D.
So that's all equal in both eyes. You were able to read both of those. So do you wear any corrective lenses for vision at all?
Just for reading?
For reading? So the next test that I will do is actually for reading. Do you have your glasses with you today?
No.
Okay, so we'll just see how well you can read, and we usually measure about 14 inches out. So we're going to have to put this newspaper sort of in front of you and see if you can read that okay.
Yep. A new liturgical year begins.
So no trouble reading that. Okay. Do you wear your glasses all the time?
No.
Okay. So they're just sort of as needed because it looks like your acuity was pretty good for the long distance too, but up close you're able to read without. Okay. We're just going to test to see your eyes responding to the light. So I'm going to bring the light over to your eye. See if the other eye accommodates, which it does. Good. Good. So you have equal accommodation for both. So I'm going to just check your eyebrows for the symmetry. They do look symmetry. Any pain or discomfort or tenderness in your eyes at all?
No.
Do your eyes, are they dry or do they water? Do you have any difficulty with them? Okay, good. Can you close your eyes for me for a minute? I'm just going to check and see if there's any. This is your left one. Any discomfort here?
No.
Good. So no problems with your eyes. And before this video, I've taken a complete history of Jen and sort of gone over some of her family history and some eye illnesses that were in her family. And her grandmother actually had some, she had cataracts and macular degeneration, so there is a history there, so that's what we would be watching. Do you get your eyes checked regularly?
Usually every year or 2 years.
You do? Okay. Next we're both going to cover our eyes. And I'm going to see when you do see my finger. Okay, so you cover first, we'll do you this eye. Ready? Tell me when you see my fingers.
Yes. Yes.
Yes. Yes. Okay, try the other side. Yes.
Yes. Yes. Yes.
Good. So no discharges with your eyes or no secretions or anything? Are your eyes dry or irritated?
No.
Okay. Your pupils look equal. Very pupils equal, and they're reactive to light both the same. So it looks like to me that they're responding as well for both. And the motor skills, but for both muscles of your eye actually are responding all both the same. So everything looks good so far. Next, we're going to test Jenny's ears. Hi, we're going to be testing Jenny's ears next. So first we have a look at them. Are you having any problems with your ears?
No.
So they both are symmetrical. There's no redness or notable irritation. You had your ears pierced very long?
Yes.
No trouble with them?
No.
Good. So the size and the shape and the symmetry are all the same. Now I'm going to have a look inside your ear, have a look at your eardrum and see if you have any wax in there and just kind of get an idea, and then we'll do a sort of a hearing test.
Okay.
So I'm going to pull the oracle back. It's shocking you? Does that hurt?
No.
Got quite a bit of cerumen in there. Do you have your ears sort of, do you clean them out once in a while?
Yes, I use the bulb with the earwax straps.
Oh, you do? Does that work?
Usually.
Got quite a bit of wax in these. I would just keep doing what you're doing and cleaning them out. It looks good. I see the pearly gray eardrum on both ears, so that's awesome. That looks sort of intact, no tears or anything, no redness. The next thing I'm going to do is test your hearing with this tuning fork. So it's sort of, the first thing I'm going to do is, just so you're not shocked, what I'm going to do is place this on your head, and I want you to, it'll vibrate, and I want you to tell me if it's both on both sides, or if it's, you know, equal on both sides, or if there's one side that you feel more than the other. Okay?
Both.
Does it feel equal?
Yeah, sort of right down the middle.
Okay. And the next thing I'm going to do is I'm going to activate it again and put it near your ear. And actually it's your mastoid bone right here. And when I touch that, I want you to tell me when you stop hearing it.
Okay.
Okay?
It stopped.
Can you hear
It's no longer making noise.
it? Okay, let's try it there. Hear that? And it stops.
Stopped now.
Good. So that's about double the time that you hear the vibration in your bone, and then you hear twice as long. So 10 seconds and 20 seconds, and that's good. That's average. That's what it should be. So good.
Okay.
When assessing the patient's hearing for the whisper test, you need to occlude the other ear so there's no compensation. And then also not let the patient be able to read your lips. So this is the demonstration we have here.
So next I'm just going to try to see how good your hearing is. I'm just going to whisper something, and I want you to tell me what I said, if you can hear me, okay?
Okay. Apple.
There was another word. Did you hear the other word? Try it over here. Let me see.
Apple pie.
Oh, she heard me on the right side. You want me to try it again? Sure. But I'm not going to say the same word. That would be cheating.
Baseball.
Good, good. So sometimes maybe it's just how much inflection I'm giving in my words. So that was Jenny's hearing test.
Go back.
We're continuing the assessment on Jenny. We're going to be looking at her nose. I'm going to both look at her maxillary sinuses. We're going to dim the lights and kind of get an idea if the sinuses are clear. Any trouble, any discharges with your nose?
No.
You don't sneeze a lot or blow your nose or...
No.
Okay, no irritants or anything this time of year. It's winter, so it's
No.
not. Yeah. Okay, good. So I'm going to have a look. It looks symmetrical. Any bone damage to your nose or any?
No.
So everything looks, there's no irritation, there's no redness, no puffiness, any tenderness when I touch the areas?
No.
Okay, now I'm going to have a look up into the nasal septum. Let's see if there's... I can see the hearing. Everything looks clear and pink. No redness, no irritation, no discharges. Good. So next I'm going to dim the lights, and I'm going to, when I see an orange halo, I'll be seeing that her sinuses are open, both on her maxillary and her frontal area. So I'm going to dim the lights. Any trouble with smelling or anything? Any strong sense other than your brother's?
black spotties?
Yes, but other than that, any irritation, that's the only time I've heard you sneeze recently, but no problems or difficulty. Okay, next we're going to be looking at Jenny's mouth. So here we are again with Jen, and we're going to be having a look at your mouth, and I want to look in the back, so I'll probably just have you just open your mouth and look in the back at your tonsils and uvula and see how the back of your soft palate and your hard palate, both, and I'll get a look at your teeth, okay?
Okay.
So first let's open up. So her mouth is symmetrical, lips are symmetrical. Any pleasure in a second while I ask you the question. Any dry mouth or
No.
irritation or anything? No trouble with your lips?
No.
Okay, good. So all the teeth are here, all 32. And you stick out your tongue, so I can clearly see your tonsils. And they're symmetrical, no swelling, no white patches. It's very good. You have any trouble? I see you still have your tonsils, so you have no trouble with your throat, no sore throat, any dysphagia, difficulty swallowing or
No.
eating or anything, hard foods, nothing like that? Okay, now I'm going to look under your tongue. So I'm going to just sort of grab it with a gauze and just look underneath for evenness. Okay, so stick your tongue out. Good. Oops, sorry. So the floor of the mouth and the lingual frenulum are pink, like they should be. I can see those veins inside there. Looks good. No nodules, no ulcerations. No, the teeth and gum, no swelling, no redness, no irritation. And the floor of the mouth looks good. No lesions or anything. And I give you A+ on your exam. Thank you very much.